Dr. Doris Day, board-certified dermatologist in New York City. I'm also clinical associate professor at the NYU Langone Medical Center, and I'm a medical journalist. I've been in practice for nearly 20 years, and in my practice I see both medical and aesthetic dermatology patients. I understand that appearance has great value, and that your skin reflects both your inner well-being as well as there's a mind-body connection that's very powerful. So with every patient, my goal is to help make that connection so that you not only look your best, but you also feel your best. When assessing the aging face, we look for an inverted triangle as an ideal of youth and beauty, as demonstrated in the photo to the left. In youth, the brows are lifted, there's fullness in the temple, and the cheekbones are high and lifted, and the angle of the jawline is relatively sharp. The chin has a presence. The focus is towards the eye and the upper face or mid-face. With age, as the individual loses bone structure and fat, the brow starts to drop, the cheeks sink in, and the chin gains fat and recedes. The inverted triangle becomes a pyramid of age. Patients develop jowls and a heavy chin, and attention is drawn to the lower face and neck. With this ideal in mind, it helps direct the approach to minimally invasive aesthetic procedures, which should be targeted at restoring balance without necessarily recreating that inverted triangle. The goal of treatment is in recovering contour for the area under the chin, as well as reflating the face and recovering volume where it's lost. We're no longer chasing lines and wrinkles, and we're not filling in folds. We're assessing every individual in a very unique way and reflating, rebalancing, recontouring back to a more natural, ultimately youthful appearance. I think the ideal facial aesthetic varies with age. We talk about the triangle of youth, and I think of youth is very important. A woman in her 50s is not supposed to have the same facial proportion of a woman in her 20s. It's not possible. It's also that a woman in her 50s has lived a life and has life experiences that comes through in her facial expression and aesthetics as well, that can't exist in their 20s. So there's a lot to it that goes even deeper than the skin. Anatomic structures change with age as well. So really, I think the ideal is looking natural and beautiful for every age, but not trying to change the number. What the triangle of youth shows us, and what we see in art, however, is this notion of balance and harmony. Artists and researchers have calculated some of these ideal proportions and mathematically quantified this harmony. Dr. Arthur Swift's research describes the story of phi, or the golden ratio, which is a mathematical relationship repeatedly reported in beautiful things. You can see this golden ratio demonstrated in architecture, music, and famous works of art. Examples from Dr. Swift's paper include a sculpture of Venus, a Stradivarius violin, and the Notre Dame Cathedral. All figures represent a consistent mathematical ratio defined as phi, and the same ratio can be applied to how we define beauty of the human face. That said, we have to realize that when we assess patients in the real world, we're not necessarily chasing a universal mathematical ideal. We're finding the balance for them. There will be differences and imbalances from one side of the face compared to the other, and we need to tailor treatment accordingly. Our goal is to create a natural balance and contour that's comfortable and that makes sense for each individual patient. And that ends up looking youthful and actually beautiful, to the point where I really believe that when I look at some of my patients at 50, 60, 70, and even beyond, they look even more beautiful with every decade. The submental area plays a key role in maintaining facial harmony and balance. Submental fullness does two things to affect the facial aesthetic. For one thing, it makes the face look unhealthy and fat, which impacts some adults' self-esteem. The second thing is that it makes someone look bottom-heavy, and it actually distorts the shape of the face. The effect of submental fullness is not limited to impacting only the facial aesthetic. When a person has an otherwise normal BMI and body type, but has some degree of submental fullness, that fullness can give the appearance of excess weight overall. For the specific concern of submental fullness, after ruling out medical causes, I tend to assess in terms of the patient's expectations and my ability to meet them. The treatments we have available currently can provide some improvement in submental fullness, but this is limited to softening the appearance or drawing attention away from the submental region. Focus ultrasound has been shown to achieve a lift or tightening of the region, which may soften the appearance of submental fullness. Reflating the cheeks through dermal fillers can also help draw attention away from the chin and the neck. For some patients who want a dramatic result and are interested in a definitive surgical solution to contour submental fullness, I'll refer those patients out since I don't perform submental liposuction. I think that as more and more patients and physicians become aware of submental fullness and its impact on facial appearance, and treatment options continue to expand and improve, it will expand our non-surgical patient base to include those consumers who are not yet bothered by wrinkles and folds of the face, but have a heaviness under their chin that they want to do something about. Aesthetic physicians should care about submental fullness because patients care about it. The ASDS just reported in their annual survey that 68% of consumers are somewhat to extremely bothered by excess fat under the chin, making it one of their top aesthetic concerns. As dermatologists, we haven't been as attentive to this area. If you don't treat something, you tend to not pay as much attention to it. But we should be paying attention as we assess patients overall. Just as we don't see what we don't treat, patients don't notice what's not there. As an example, when I was an adolescent and finally had my braces off after 2.5 years of being metal-mouthed, I was so excited. I went back to school and I was grinning and smiling big at all my friends, and finally they asked why I had this big silly smile on my face, but none of them even noticed the braces were gone. They didn't notice because the braces weren't supposed to be there. When we provide patients with a good outcome, for example, if we're able to contour submental fullness and in turn improve overall facial appearance, people will not be able to pinpoint exactly what that patient has had done. In the same way that people don't notice when another person's brown spots are gone. They notice a person looks better, but they don't know why. It's because that wrinkle or frown or submental fullness, like brown spots on a face or the braces on my teeth, is not supposed to be there.